And this time last year, COVID-19 cases started mounting across the country. Hospital beds started filling up, turning into a full crisis for Arkansas's healthcare system.
As we head into the winter months, doctors and nurses wonder what's around the corner. KARK 4's Mitch McCoy goes into UAMS looking not only at nurses' shift, but the COVID shift.
It's Tuesday, 9 a.m.
My name's Brandon. I'll be your nurse today.
There's a COVID-positive patient fighting to survive. Brandon Haley is just one of the nurses on the front lines at UAMS in a war against the coronavirus.
It's something that we walked into the profession seeing.
He's only been on the job for a year.
But at one point, this entire floor, which was 14 beds, was full of COVID patients.
The new graduate has lost count of the number of COVID patients he's cared for.
It takes a toll on you for sure, because you just see some of the worst outcomes from something that can be preventable.
Haley has seen more people die.
I've been here almost 14 years.
And many nurses with more than a decade on the job.
And I've seen more death in the last 2 years than I've seen the entire 12 years previous.
Elizabeth Sullivan is the UAMS ICU Clinical Services Manager. On this shift, just hours before, the intensive care unit lost a COVID patient and is preparing to admit its next positive patient at any moment.
They have increased oxygenation needs, so they may need BiPAP, they may need high flow for more than we can do safely on our medical surgical floor.
UAMS has 10 coronavirus patients now, significantly lower than the 78 it had several months ago, but it is a revolving door, with patients coming in, but no one knows how the patient will leave.
It is emotionally draining. It is devastating to try your absolute hardest and still have bad outcomes.
Upstairs, on the hospital's 8th floor, a surgery recovery unit.
I think that represents a sign of hope.
Whitney Hicks is preparing a room for a non-COVID patient who's in the middle of an operation now.
The patient they were about to receive to this room now today, and he's been waiting on this procedure for quite some time.
Several months ago, this room had been used for coronavirus patients, but hospitalizations have been on the decline, freeing up beds for other medical needs.
A sign that there is a light at this end of this tunnel, that we are able to care for all of these patients that are not COVID positive that we haven't been able to care for in the past.
Make sure that their respiratory status is good.
Back to Haley, he's checking in on his COVID cases.
See how we can wean them down, along with putting on their antivirals and their steroids.
Every breath is a reminder the battle is not over, and with winter weeks away,
I would be scared to see how the cases rise.
Haley hopes COVID does not send Arkansas back into full combat.